Hey everyone, welcome to Medical Terminology Basics, Lesson 2. This is a continuation of Lesson 1, where we began exploring how to break down medical terms into prefixes, roots, and suffixes. Today, we'll focus on medical conditions and processes, and I'll end with some practice problems to help solidify your understanding. Let's start with some common medical processes. These prefixes and suffixes are used to describe various abnormalities or conditions. For example, dys means problem or abnormal, as in dyspnea, abnormal breathing. Similarly, mal means bad, as in maladaptive. And remember, itis? It refers to inflammation, like in colitis, which is inflammation of the colon. Now let's discuss terms related to growth and disease. Plasia refers to growth, such as hyperplasia, which is an increase in the number of cells. Oma refers to tumors, such as sarcoma. Remember, trophy describes growth in the size of cells rather than their number. Finally, pathy indicates a disease, such as neuropathy, which is a disease affecting nerves. Next, we have suffixes that describe conditions or states. Osis typically refers to an abnormal condition, such as sclerosis. Similarly, II refers to an abnormal condition, while ism describes a state like hypothyroidism. Lastly, IC and EL mean pertaining to, such as encephalic, pertaining to the head. Some additional processes to note include meta, which refers to change or transformation, such as in metaplasia, a transformation of cell type. Stasis refers to maintain in normal conditions, while its opposite, lysis, refers to destruction, like hemolysis, destruction of red blood cells. Finally, megaly means enlargement, and pania indicates a decrease, such as cytopenia, which means decrease in cells. Let's move on to medical procedures. Ectomy means removal, such as appendectomy, removal of the appendix. Otomy refers to cutting, like tracheotomy. Ostomy involves creating a hole, as in colostomy. Scopy is used for viewing, as in endoscopy. Finally, graphy and gram refer to recording, such as in mammogram. There are also prefixes commonly associated with procedures. Chemo refers to chemical treatment, as in chemotherapy. Echo or sono relates to sound, like in an echocardiogram. Lastly, electro refers to electrical charge, as seen in electrocardiograms, ECG. To wrap up, we've covered processes, procedures, and practice terms. Remember, understanding medical terminology is all about breaking down words into prefixes, roots, and suffixes. Practice is essential to mastering these terms and applying them in a medical setting. Thank you for completing this lesson.